This is Dr. Stephen Myers at Fresh Start Bariatrics at Riverside here in Columbus, Ohio. And I have LeeAnn Kartak with me. And I'm just going to ask her a few questions. LeeAnn, you had which operation and when did you have that operation?
The Easy Lap Band, is that what it's called?
The Realize?
I'm sorry.
That's okay. Realize Lap Band.
Realize Lap Band in 2008, November.
Okay, so that's been, at the time of this recording, about 2.5 years.
2.5 years, yeah.
And first of all, it's unusual because you had type 2 diabetes.
Yes.
Why don't you tell us what medicines you were on for your type 2 diabetes?
At the time of the surgery, I was doing the Byetta, the insulin injections, twice a day, I believe.
Okay, the Byetta twice a day,
Twice a
and I
day.
think you were on Actose as well, or something like that?
Yes, I was, yes.
Okay. And what are you on now?
I'm on nothing. I take no medication for diabetes now.
Okay. And you had an adjustable gastric band. I just wanted to remind everybody.
Yes.
Now, but you've had an unusual result in that you've lost a lot of weight as a result of that. So do you mind telling us what your weight was like before and what it is now?
I was at 323 when I started this.
Okay.
I'm at 200, so I've lost about 123 pounds.
Congratulations.
Thank
I mean,
you.
that's really awesome. And tell us a little about that. Did it come off rapidly, slowly? What do you think?
I average about a pound a week, which I like because to me it stayed off. I haven't put anything back on, so I've averaged about a pound.
And you've continued to lose about a pound a week
Yes.
over this period of time?
Yes.
And how much more did you want to lose? You look great today to me.
Another 20. I
Okay.
like to weigh about 180. I'm tall, I'm 5'8", so I can carry that.
That's great.
Yeah.
All right. Now, tell us why you chose to have an adjustable gastric band as opposed to one of the other operations.
Okay, I like the idea that if there were complications, it was reversible. It wasn't quite so invasive. And I like the idea of losing the weight slowly because I think with me, I didn't want all the hanging skin. I know that can happen. And I'm old. I'm 58, so.
You're not old. I'm 58, so you're not old.
But I just thought that was better for me. It was better for me not to lose it so quickly.
Okay. And are you generally pleased with your result today?
Oh yeah, I'm having a great time. Yeah.
Now, something else that was interesting, LeeAnn, and that is you were telling me about your hair.
Yes.
And you have an unusual story to tell us about that. So why don't you tell us a little bit about that?
Well, I've lost most of my hair because of the weight loss, so I wear wigs.
And I think it's important for people to understand that that's very unusual. I don't have anyone else in my practice of 1,000, way over 1,000 patients that have that. But you had a lot of thinning of your hair beforehand, and why don't you tell us about that?
Well, I have PCOS, and that's kind of a side effect of that, the polycystic ovary syndrome, and you kind of have the male baldness pattern. And so I didn't have a lot of hair to begin with, so true, but it's very, very thin now, and it hasn't come back. So I just kind of chopped it all off, and I wear wigs, and I love it. I love looking different every day. It's a lot of fun.
That's great. And again, that's not related to your band, and
Right.
it would have, if that was going to happen to you, which is very unusual, like I said, it would have happened to you no matter how you lost weight, probably. Which operation or whatever.
Maybe
It's
not
not.
so quickly, but
And I guess I just wanted to make sure everybody knew that it's not related to the band or anything like that. It's just your PCOS and your particular circumstance, which,
Right.
like I said, is unusual. But thank you for sharing with us. You did a great job. You weren't nearly as nervous as you thought you
No.
would be,
it
LeeAnn.
wasn't bad.
And I'm just delighted that you're doing so well.
And I appreciate, you guys are so good to us here, and I appreciate all you do for us, and I love coming. I love seeing you guys.
Well, I love to see you too because you have a different head of hair every time I see you. How does your husband like your...
Brian has his favorites. Mine are different than his, but when I go out with him, I wear his favorite.
That's fun.
Yeah.
Okay, LeeAnn, thanks so much for sharing with us.
Thank you.